أهلا بكم أعزائنا المشاهدين حلقة جديدة من برنامج اسأل مع ميرا. Today we're very honored to have one of America's leading doctors and cancer scientist, Dr. Vicky Yamamoto. Hello, doctor.
Hello, hi. Pleasure to meet you here.
Thank you so much for your time, and it's lovely to have you. Today's very important subject. We'll talk about cancer, treatment, risks, and many more. And can you please, or could you please provide us some of your insights into your background, please?
Sure. Hi, my name is Dr. Vicky Yamamoto. I'm currently working as a cancer researcher at USC Pick School of Medicine. And also USC Norris Cancer Center. So my background, I have a PhD in molecular medicine and biochemistry, and my current research mainly focus on how to treat, how to diagnose a better way for head and neck cancer and as well as a brain tumor.
Okay, great. So, and how many years have you been researching cancer, doctor? And why cancer specifically?
Okay. Yeah, I always have been actually interested in cancer. I have been actually working at the Cedars-Sinai Medical Center in the neurosurgery department to study about the GBM, a brain tumor research, even before I start my PhD. So after that's including my US working years at the USC, PhD, and my current research, it's been almost 20 years now.
20 years, and you are one of the America leading doctors in cancer, so thank you so much for all your help for the community. I am a little bit sad because you told me something before the show. You told me that Japan, and we know Japan is very advanced, but they have more research, and it's easier in Japan to spot the disease before it goes like bigger. So can you tell me why these techniques are not here in USA?
Oh, okay. Yes, I think the biggest obstacle here, like for instance, my family are from Japan originally, and over there they have a better, annual screening, which almost everyone will actually take part.
Everyone? Wow.
It actually, it's all covered by the health insurance, And here in the United States, unfortunately, there are so many people who are not insured still, and they have even if they have a good some of this insurance system, they could not actually take advantage of getting a screening. So that's one sad thing about what's happening here in the United States. But fortunately, in Japan, they have a insurance system for pretty much everyone. And each city that the way they live in encourage annual checkup, and they're all covered pretty much. So
okay, and hopefully, yeah. So it's the American system. It's not just it's a machine. We don't have it here. It's the American system and the insurance. That's what you're saying, right?
Yes, that's strongly I believe so.
Okay, yeah. Hopefully this will improve. And now let's talk about your presentation. You have a great presentation. Thank you so much for providing us with this presentation. So now let's talk about the mortality rate first, the current one, and we'll go from there.
Okay, maybe if you can actually go for page number 1.
Okay, page number 1. We'll start with page number 1.
Which is about the overview of cancer. So I actually intend to talk about the overview of cancer, which is the basics and statistics and what event.
Is there a certain age the cancer target?
Targets. Oh, okay. So cancer. So there are two distinct, type of cancer. One is a pediatric cancer, where this type of cancer normally happens to small kids, like babies, infants, so they are, primarily considered as one of developmental, biology, defect. But then most other type of cancer, what happens is that the cancer will usually happen as the accumulation of a mutation, right? The DNA mutation will start to accumulate, and that's how the cancer starts. So normally in such cancer, as you age more, as your age advances, the cancer rate will start to increase.
Okay, and right now I know there is lots of great treatments. We'll talk about that in a minute, but we need page number 1.
So
if it's ready.
Overview. So maybe if you can go, maybe you can actually go straight to page number 3.
Oh, page number 3. Okay, let's switch to page number 3. And so we have page number 3. That cancer is a worldwide problem.
It is the worldwide problem. So I'm not so sure if you can see from the screen, but so you can see that the WHO, or World Health Organization, estimates that there probably will be approximately 20 million new diagnoses and almost close to 10 million cancer-related deaths can happen this year. And then this figure will likely to actually double within the next 20 to 30 years because of the increasing lifespan and as well as the increase in population.
That's so sad.
Yeah, okay. So, and then I'm not so sure if we can, okay, great. Yes, that's the slide I was talking about. And then if you can turn to page 4 next time.
Page 4, okay.
I'd like to talk about the global cancer incidence, and which is actually list up the top 15.
The top 15 list, yes.
Cancer list. So if you can take a look at it,
yes.
The top 3 common cancer among men is lung cancer, prostate cancer, and colon cancer.
Okay.
And then for women, top 3 cancer are actually breast cancer, lung cancer, and also colon cancer.
And these are the deadly ones? Or it?
No, fortunately, actually, it's not. So, so maybe I don't know if you have a screen in page 3 or page 4, but you can go to page 5 now.
Page 5. Yeah, you told me the most dangerous one is the pancreas, right?
Pancreas is one, but then brain tumor is also one.
Brain tumor, yes, of course. Okay.
Well, I can see from page 4.
Page 5. We are on page 5 right now.
So I can explain some of those cancer. Each type of cancer has its own, mortality, right? Mm-hmm. So if you take a look at page 5 of my slide, you can say that. So, for instance, men, lung cancer is very, very common, right? With the bar with the blue. But then when you take a look at mortality is very high for lung cancer. And if you take a look at the prostate cancer also have a very high incidence rate. But then mortality is pretty low. So that means this type of cancer is easier to treat. They grow slower than other type of cancer. And then because we have a now much better, surgical, treatment and, chemotherapy, we can control prostate cancer really well. So because of that, see the red bar, remember, for the men's category, prostate is low, right? Compared to blue one, which is incident rate. And on the other hand, if you take a look at the right side, that's a statistic for women.
Yes.
So obviously, number 1 colon cancer is breast cancer, right? The blue bar is very high, right? Mm-hmm. Take a look at the mortality. The bar is very, low, and that's because of that for the past 20, 30 years or so, we spend billions and billions of dollars for research, and we try to have a better, chemotherapy, radiation therapy, and as a result, luckily, breast cancer now is, much, treatable compared to 20, 30 years ago because of research. So it is low. But if you take a look at the woman's, second leading cause of cancer, which is lung cancer, see, when you compare with the blue bar and the length of the red bar, which is mortality is relatively high, right?
Yes. Correct.
That's,
so the lung cancer in men is very dangerous more than the breast cancer in women.
I think, in some cases, yes.
Okay, got it. Okay.
So, but then if you can take a look at the page number 6, if you can look at the next one, that'd be great.
Okay, page number 6. Okay.
So because you actually told me early on that our audience will probably have a lot of Arabic community, as well as the Egyptian community.
Like Egypt, there is 1594 cases. What is it?
So I actually was a kind of curious. What is the cancer incidence in China or Middle Eastern and North African countries? So it turns out that actually, when you compare with the other Western countries like Australia, European countries, and the United States, the cancer incidence, which is age-adjusted rate, for instance, per 100,000 people, the rate of incident is much lower in those Middle Eastern and North African countries, which is great, right, compared to other advanced nations. So it turns out that there are many people speculate, that maybe this is because of partially genetics predisposition, or maybe the fact that maybe those Middle Eastern and North African countries consumption of alcohol is much less compared to other nations.
Uh-huh.
Maybe like smoking rate, especially among women, is much less in those Middle Eastern countries, right?
Yes, correct,
And
correct.
they also consume more food, healthier food with
Okay.
the spice, enriched with the spices.
Okay, that's a great conclusion. So you were talking about that they don't consume alcohol and cigarette. That's why there is a lower rate in Arab countries.
Yeah, so that's actually just the only still speculation. There's just
yes.
So people actually, of course, scientifically, in order to really make a conclusion, they really have to do some sort of clinical trial. But then people speculate, and based on these factors, that's most likely because of these factors. But then we can scientifically we cannot make a conclusion.
You cannot judge. Yeah, you cannot judge. Okay, I understand.
Yeah, but then maybe because of the difference between those Western European countries versus Middle Eastern countries are those differences. So based on that, they speculated.
So do you think our eating habits could cause cancer?
Oh, definitely, yes. Because some of those cancer types, like let's say colon cancer, lung cancer, for instance, right? These are caused by smoking to consuming the food with too much fat, too much sugar, and then that causes obesity, right? In the United States, obesity is a major problem, and then so those are the factors that can raise the incidence of cancer, and then these are preventable, right?
Yes.
Yes.
Yes, so perfect. So okay. So now we have some idea about So if you eat healthy, your risk will be like decreased.
It will, yes. Supposedly it will actually
alcohol, smoking, and eating healthy food.
As well as moderate amount of exercise. Keep yourself active.
Okay, we have a question. What kind of healthy food? Healthy food is healthy food, but do you have any comments on this question?
Yeah, healthy food. First of all, I think this is pretty much probably common sense, but eat plenty of vegetables.
Vegetables, of course.
And then
organic food.
Yes, organic is better. Yes.
Definitely, yes.
Next, amount of vegetables, and then take some, fruits time to time, of course, and then take also, good quality of protein, and not enriched with the red meat too much, but take a white meat, like a chicken and a turkey meat.
Okay.
Take fish, for instance. That's a really great choice for the protein source. And red meat is also okay, but try not to eat every day.
Not a lot. And I think avoid plastic, avoid microwave. These are the common sense things.
Common sense, yeah, exactly.
Yeah. Okay, but we'll go into the deep, but in a bit.
Okay, gotcha. So maybe for the time being, maybe if we can actually put the page number 8, that'd be great.
Okay.
Now, from a global aspect, now we'll switch to
global
US.
Aspect, okay, we have page number 8, 2 million new cancer diagnosis, and 6, wow, that's a lot.
A lot of cancer, yes. That's actually projected in 2020.
Where is that? 2 million new cancer cases and 620,000 deaths. Where? In the US.
This is now switched to statistic in the United States now.
Oh, it's US, okay.
So take a look at page number 8, that'd be great. So in the US, approximately about 2 million new cases, as you see. And then if you take a look at the cancer, common cancer for male and female, this is pretty much similar to global statistic.
That's
so
a lot.
Then the common cancer for men is usually prostate cancer. Yes. And is number 1.
The lung, you said?
yeah, lung cancer, and the third one is colon cancer. For women, same as the global, cases, but breast cancer is number one cause, for cancer type, and followed by lung cancer and as well as colon cancer. So it's pretty similar to the global statistic.
Okay, we have a silly question. I know the answer for the question, but because someone asked this question, can the cancer disease be transferred, yes or no? I know the answer, but can you please let us know, since we have this question from one of the viewers?
Sorry, I don't have to get the question. Transfer means?
Sorry?
What did you
Can someone transfer the disease to his friend or his family member?
Oh, family member, not physically, of course not.
No,
but then,
of course not. Of course, yes.
Yeah, it will not. Transfer in the sense that some cancer types are genetic, right, which is really rare. But in that case, you can transfer to next generation. So that can be something. But then physically, if you have a cancer, it's not like what do you call it, the infection disease. So it's not going to transfer to another
Yes.
person. But you don't have to worry.
Okay.
Okay. So so we have so many cancers. So then the next, if you can turn to page number 10, that'd be great.
Page number 10. Okay.
You that cancer treatment can be very costly. So in the United States, as you probably some of you know, that number one cause of bankruptcy is because of financial burden from healthcare cost or treatment of a disease, and likewise, cancer is a pretty expensive disorder to treat. So in the United States, for instance, the total cost of cancer in the United States back in 2009, this is a little bit older statistic, but it was cost $216.6 billion in total. And then by the year 2030, those cancer costs were expected to reach about almost $500 billion, so which is really, really costly to treat.
Correct.
Yeah, so it's really not only the burden for your health, but then it's actually financial wise. It's also will be a huge burden to treat the cancer.
Of course.
And maybe then next thing I can talk about is perhaps page number, because of the time, maybe I will skip for page number 12.
Okay.
So page number 12, I just wanted to show what kind of progress that we are making in medicine.
Wow, we're making great progress.
So far, the cancer type that we are making a great progress is what we call, the blood cancer or hematologic malignancies. So when I was a small kid, when someone said that, oh, I have a leukemia, right, that's type of blood cancer, then it's almost like a death sentence. You pretty much die from leukemia. But then for the past 20 years or so, we are making a huge progress in having a great chemotherapy. So nowadays, if you can show again, page number 12, that'd be great. Yeah. So if you take a look at the left, panel, this is a 5-year survival. So this is the number of cancer patients who are still alive after 5 years of diagnosis. So in case of, let's say, the most really common one is
okay. Doctor, I'm sorry, but how they reach it those 5 years when there is people in 2 weeks or 6 weeks, or 6 months maximum, they die?
Right. Yeah, it's going to be actually included in the calculation, but then commonly we normally measure the number of people who passed away after 5 years. But then I know that for some type of cancer, they also have a statistic on 2-year survival or 1-year survival as well. But then 5-year survival is, kind of a, for us, it's a great timing because, probably some of you may know, if you survive 5 years or more after the treatment, then you are being considered to be like in a remission, meaning that the cancer is kind of treated. successfully, right? So that's why
Yeah.
5 years is a really important, the measurement for us.
Okay. So
So for
before you go on, because I have few friends they already passed away from cancer, and this is like break my heart. So one of my friends, she diagnosed of leukemia, and she lived 1 year. Once she started taking chemotherapy, and the blood had 5% of leukemia. Once she started to take this chemotherapy, the cancer or the leukemia jumped from 5% to 95%, and she lived only 3 months. So I think that chemotherapy is not working with everyone. So how do you scale or decide if this patient needs a chemotherapy or no? Do you have any way to figure it out or not?
okay, so from what I heard from you, it seems like that this your friend with the leukemia, she may probably develop resistance.
Yes, she had something. Yeah, she had some resistance. Correct.
Right? So basically, the same treatment or the treatment that she received somehow may kill some subtype of cancer, but then the vast majority.
Her body fought it actually.
Oh, I see. Yeah, I'm so sorry to hear, but this is actually still happening. Not
Still
only
happening.
now,
So
but then
yeah, chemotherapy you cannot just guarantee the result because lots of people died from chemotherapy.
it is. And then one of the problem with the chemotherapy is that some of those chemotherapy will attack pretty much also normal cells as well.
Yes.
Normal,
Normal.
of course, rapidly growing cells are usually the cancer, so they attack those cancer, of course, but then they also tend to attack normal,
Normal
cells.
and healthy cells. Yeah. Okay. Normal and healthy cells. Okay. Got it.
Problem. And then sometimes what happens is that the side effect is too much. Some cancer patients unfortunately will succumb to having too much what do you call it side
Yes.
effects from chemotherapy.
Okay.
So in the next topic that I'm going to talk about is the how it is important to select targeted therapy or precision medicine.
Okay, perfect. So there is alternative than not only the chemotherapy, there is alternative, right?
There are some good
Okay,
medication.
perfect. Okay.
So,
Okay. So before we go on, I'm sorry, I know you want to finish the presentation, but we have one call from one viewers. Can we take it first, please? Hello, Susie.
Yes. Dr. Yamamoto, thank you for taking your time on a Saturday to bring us up to speed on what's going on with cancer. I have two questions, actually. One question, I don't know if I missed it, but when you were talking about Japan and the screening that they do in Japan, in the United States, I know we do the breast cancer screening and also the colon cancer. What are the other screenings that is done in Japan?
Yeah. So there are so many. Yeah, I'm actually not too completely familiar with the current situation right now. But then my understanding is that those besides breast cancer, prostate cancer, right?
Prostate
These are
cancer
both
for
common
women.
in women. They also, my understanding is that they also have couple of very high. Like 5 common cancers for men and women. That's including lung cancer, right? Lung cancer, prostate cancer, breast cancer, as well as a colon cancer. So those are really common ones that the people are always encouraged to screen. But there are also a couple of some prefecture in Japan, not all of them. My understanding that some prefecture is also try to tackle with some of those hard to treat cancer like a pancreatic cancer. So those prefecture in Japan, they kind of make their own risk factors list. That if that person has a high risk factor, like having a family member who got pancreatic cancer, as well as someone who with chronic pancreatitis, which is inflammation of pancreas. someone with diabetes or someone with obesity. So these are the high risk factor for developing pancreatic cancer later on in life. So in such case, then those people are encouraged and covered by insurance to get the some kind of early screening. That's including image using what do you call it, ultrasound, which I don't think that the U.S. has this.
Yes. Okay. My other question was, I had heard that with organ cancer, like liver cancer or anything like that, usually the cancer will start somewhere else, and then it would go to the liver. Which organ is that true? Because you talked about lung cancer, but it seems that lung cancer can just happen. There's nothing that has to, not another type of cancer has to be there before the lung.
Yes, yes. So, so for cancer, strictly speaking, there are two types. One is a cancer which actually arises from that organ, and as well as a metastatic cancer. So in some cases, like for instance, if you have a lung cancer, as the primary origin is a lung, sometimes what happens is that cancer travel to other parts of the organ. That's including the liver and also like a brain and so forth. So yeah, you are right. So there are some type of cancer that easily actually metastasize or jump into another organ, like a breast cancer, for instance. Breast cancer is known to happen in the breast first, and then known to migrate preferentially to the brain, as well as some other organ like a bones, for instance. So some type of cancer have some kind of a preference in which organ to migrate or metastasize. So each type of a cancer has its own preferential site.
Okay. Well, thank you very much.
Thank you, Susie, for calling. Thank you, doctor.
Okay. So I think maybe so.
Yeah, we have time, doctor. Don't worry. Yeah.
Because we are still in page number 13. So if you can actually go to page number 13, that'd be good.
14 or 15? I'm sorry.
13.
13. Okay, 13. Page 13.
So for that one, I would like to talk. Okay, so what do you do if you or your loved one
that's important topic.
Yeah, so that's something I really want to actually think about really carefully. So one is that not all doctors are the same.
Correct.
So shopping around, meaning that you have to really research your doctors carefully. Even when you say that, oh, I'm an oncologist and I treat cancer, doesn't necessarily mean that this oncologist is specialized in certain type of cancer. Like for instance, if you have a breast cancer, you probably better to go to see doctors who
and only breast cancers. Yes.
And successfully treat the cancer. So that's a really important item. So research your doctors carefully. That's important. And then try to seek second opinion, third opinion if necessary, because not all hospitals or clinics offer the same treatment. So some treatment is maybe better than the other. We don't know yet, right? So it's better to seek second opinion, third opinion if you're not really so sure. And one thing I also wanted to actually say is that try to of course your local hospital is also good too. But then if available and if you can actually go, try to visit what we call comprehensive cancer center, because comprehensive cancer center is often actually set in academic
research, like the one you're working at, right?
Exactly. So those type of a hospital will have a lot of more resources compared to some regional hospital, because they do research on site, and they actually also have a variety of different clinical trials. If nothing actually works, if no conventional treatment works, then there's always some kind of alternatives as well. So that's one thing I would encourage, and because that comprehensive cancer center also has some kind of equipment to do a lot of molecular.
Okay. And is it easy, doctor, to reach the comprehensive cancer centers?
Yeah, just go. So if you can take a look at the, okay, so before you go, maybe I will just talk that, try to also, I know that, they may probably have a tons of other, some treatment which is available, but then some treatment, especially if you don't go to big hospital or big clinic, small
Yes.
sometimes offer like oh, we have some trial, but then this may not be FDA approved. It may not be safe even if it is not really effective at all. So just be careful. Don't jump onto some unapproved.
Even the big hospital, there is a big hospital in Duarte, I don't want to say their name, but they are specialized in cancer. Even though you have to like take a second opinion or first opinion from the comprehensive cancer center. That's what you're saying, right?
Yes, exactly.
Okay.
So what I would encourage is that if in case that if you want to test on clinical trial, for instance, and later on, make sure to go to check and then study. So the two best website that you can check whether this is a really good clinical trial or not is go to visit www.clinicaltrials.gov.
Okay, clinicaltrials.gov. If anyone has a problem with cancer or history of cancer, we need to talk about history. Like if your parents has cancer, you could be like, in the future you get the same disease. So again, can you tell us please the website and we can go and check يا جماعة دي. It's very, very important. تفضلي. Okay, go ahead please.
Yeah, so what I can do, I can share the because I think page 2 is gone already, so I can actually share you the website that maybe at the end. I can share a link so that you can circulate to your audience.
Okay, perfect. I can provide you guys بعد كده هسيب لكم اللينك اللي تقدروا تروحوا وتعملوا التحاليل بتاعتكم والترايلز بتاعت الكانسر. Okay, doctor, go ahead.
So if you can turn to page number 14. So I talk about this importance of this comprehensive cancer center. It's page 14. So here in the United States, so we currently have about 72 National Cancer Institute designated cancer center. Okay. And 72, 56 hospitals are considered to be comprehensive cancer center. So this is a type of place you really want to go visit. First, or if not, then second opinion, third opinion, of course, and then see which hospitals will have a good option to treat. So in Southern California, luckily we have 5 comprehensive cancer center in Southern California. That's including USC, which where I work right now. Yes. And also UCLA, in West LA, and City of Hope in Duarte, which is close to Pasadena side. Yes. And I know that for your audience, I think they are in the OC, right? So the closest comprehensive cancer center you can go is located in UC Irvine, as a UCSD. So those are 5 comprehensive cancer center. Is probably the best place where also you see. So you could be like a hospital and at the same time comprehensive cancer center. Exactly. Yes. Exactly. Okay. They have its own cancer dedicated hospital. So that's where we are located. So those are something that I really encourage you to go, and so that before you start treatment or before your loved one start treatment, you have many options, right? What kind of option you have, and then pick the best one. So those are something that I really encourage you to do. So maybe what you can do, you can actually go to page number 15, if possible. Okay, before page number 15, I'm sorry I'm talking a lot, but I saw like 2 cases in past like 3 or 4 months. They just went to regular checkup and they find out that they have cancer. Within 2 weeks, they were like dying. Do you think it psychologically affects the patient? Because he did not have any idea before he went to the checkup, and once he knew, his immune system like gone to the the ground, and he was dead in 2 weeks. Is this something? Do you understand this? Is this something true? Well, it may not be psychological, of course. The patient who are diagnosed with the cancer, I'm pretty sure it's it causes huge shock, right? Of course, it can cause a stress. But I don't know exactly what happened to your friend. Do you know what kind of the cancer? Was it leukemia? I think it was lung cancer. Oh, lung cancer. Okay.
Yes.
Do you know if that was already stage 4 or no?
I don't know.
You
No.
don't know. So I don't know, like how he also, this person died as well. Is that because of a heart attack or something, or?
Yeah, I don't have too many information, but what I hear that he went to check up and he never been out of the hospital, but after 2 weeks when he was dead.
Did he start chemotherapy already or no?
Yes.
Yes, okay. So sometimes what happens is that if the patient is not, having almost the end stage of cancer, meaning that the cancer progress and spread everywhere, right? For instance, like a couple of organs are already affected with the cancer.
Okay.
And then once you start chemotherapy, what happens is that it can cause.
But is the shock enough to kill you? The shock of the news.
Shock alone should not be the primary cause of this person to die. It's rather more like probably like a multiple organ failure.
Oh, organ failure. Okay.
Yeah, because what happens is that if someone is already in end stage cancer, what happens is that your entire body or entire what do you call the organ function, it's so low already.
Okay.
So if you start chemotherapy sometime, if you're relatively healthy, a little bit the early stage of cancer and your organs are still healthy, then your body can sustain, all this damage from chemotherapy. But then sometimes what happens when someone is in end stage, cancer spread almost everywhere, then what happens is that your like a function, especially important function, will be kidney and the liver function. So if the liver and the kidney functions are not really well, then what's going to happen is if you administer chemotherapy, what happens is it's going to, of course, damage some of those, again, normal organs, right? That's what the chemotherapy will do. And then what's going to happen is that if your organs function is not functioning really well, then their body will be overwhelmed. And then it's going to shut down the function of some of those organs. Then as a result, this person may die. So it's really important that, before you start the chemotherapy, make sure that the patient's, liver or, and also the kidney is healthy enough.
It's healthy. Okay. Yeah.
So they can sustain.
Okay.
If not, then it's not worth to, start the chemotherapy because chemotherapy itself may kill the patient, right? Which is not the intention for, everyone, right?
So within your researches, did you encourage the chemotherapy or sometimes you say just wait till we do more research?
Some type of cancer, most cancer, if you, let's say, in the early stage, maybe you can wait, but then, it's not a good idea to, because especially the cancer type is really aggressive type. You can't wait for, let's say, like 1 year or 2 years. You can probably wait for another like a month, like 1 month or so to just to, research yourself or go to a couple of different doctors, then they get, try to get the correct diagnosis and get the different options of treatment. Yeah, waiting 1 to 2 months should not be a big problem. But then, waiting for 1 year, 2 years is not a good problem. I mean, good, solution.
Okay, you cannot wait more than 1 year. Okay. It makes sense because one of my friends, she waited 1 year, then she started the chemotherapy, then she died within 3 months. So 1 year it was her max to wait.
Yeah, no, not the max, but then probably like one to 2 months to study and check with the different doctors. That's doable. Because usually cancer grow over time in a course of 5 years, 10 years. So it's not 1 month later it's gonna start to explode, right? So it's better to
it's better to address it very, very quickly.
2 months is okay, but then don't wait too long. And then in case of some type of cancer, for instance, like leukemia, for instance, if you find leukemia, you have to treat immediately. You cannot wait for 1 month, 2 months normally.
Oh,
so,
okay.
The different type of cancer, like how fast the cancer progress, right? Some cancers grow slowly, like for instance, like a prostate cancer. Prostate cancer these days, if they are not growing too fast, they usually just leave and then just monitor, right? Because prostate cancers, in general, they tend to grow slowly. so they don't do anything sometimes. And then
Okay.
they could see if how they progress, like they become bigger and bigger, then they do some, surgery or they administer, chemotherapy and so forth. So each type of cancer has its own, progress rate.
Yeah.
Each,
It's
even the same cancer, sometimes some subtype of cancer grows slow or fast. So really depending on, the size and what type of, subtype of cancer.
okay. Thank you so much, doctor, for explaining. This part is very important. We have one question about the tongue cancer. Is it rare, and what causes the tongue cancer, especially there is no alcohol or smoking?
Alcohol smoking. Okay, so tongue cancer. Well, actually, my specialty is the head and neck cancer. So I'm glad that you asked me a question. So tongue cancer. Okay, so no smoking and no
No alcohol.
heavy alcohol consumption, right? So in that case, then normally this may be caused by HPV, the virus infection.
Virus? What kind of virus?
HPV is the human,
HPV.
human papilloma virus. It's the HPV.
Okay, HPV. Okay.
So normally with the HPV causing cancer in the head and neck region, it's not actually happening in the tongue, but it's more like in the the back side of the tongue or close to the throat.
Oh, okay. Here. Okay.
Yeah,
So
that's a
from
typical.
deep the tongue.
Yeah, not the not the front side of the tongue.
Okay.
Front side of the tongue, the cancer can happen. Typically for someone who is a heavy smoker, and also with someone with a heavy alcohol consumption. So that may cause a cancer of the tongue. But then if this is caused by HPV, the virus infection, then
okay.
usually it happens in the back side of the tongue or close to the throat area. That's a really typical site.
But it's a rare kind, right? It's not common.
It's not, no, actually the number of HPV positive head and neck cancer is actually on the rise right now.
Oh,
Because-
it's a rise level? Okay.
Yeah, so it's not really rare anymore. At the USC, my understanding is that almost like half of the people who are diagnosed with the head and neck cancer are HPV causing cancer, not the smoking or alcohol consumption. Because these days, even in the United States, the number of people who are smokers are declining. Right.
Okay. So you guys stop smoking and drinking, please.
Oh yeah, heavy smoking, absolutely. If you are a smoker, please quit.
There is people using the vape right now, doctor. I'm so sorry I'm cutting out. I'm really sorry, but I'm just, because smoking is like one subject like irritating me. So there is some people, they smoke hookah or vape. Is it like same effect like cigarette?
I think, so I'm not really too familiar with the hookah, but if you actually, the substance that you're smoking contain carcinogen, then it will be same as a tobacco, because tobacco,
okay.
so if there's no, any carcinogen in something that you're smoking, that's fine, but then most likely
Okay. So
if
the
hookah
problem, okay.
carcinogen material, then it's actually not good.
So the tobacco is a problem. Is the
Tobacco
real
is
problem. Oh, the tobacco. Okay, got it. Okay. Thank you for explaining this, and please go on with your presentation. I'm really sorry. I keep
it's okay.
asking you questions.
No, I'm glad that people ask questions so that we can answer.
Okay.
So I really appreciate that. Okay, so for what kind of new treatments are available? Okay, so if we can, so the sake of time, maybe if you can go for page number 16, that would be great.
16. Okay.
16, yeah.
Okay, immune therapy. This is one very important question. Okay.
Yeah, so traditionally before maybe like about 10 years or before, the three main kind of treatment for cancers are primarily surgery, post-surgery, radiation therapy, and chemotherapy. So now, because of approval of many different type of immunotherapy, especially what we call checkpoint inhibitor. So this is now approved to treat certain type of cancer. So immunotherapy is now fourth pillar of cancer treatment right now. So which is a really great news for all of us. because so for instance, maybe if you can take a look at the, oh yes, in the screen, you see that those two typical, checkpoint inhibitor immunotherapy, which is called Yervoy and Opdivo. So these are, approved to use in, skin cancer, especially in melanoma, as well as some type of lung cancer, which turns out to be very effective. So this is a really good news to all of us. But at the same time, there are a lot more other, type of, chemotherapy, immunotherapy, which is still in either clinical trial or still in small animal, testing on a small animal. That's including what we call CAR T therapy, as well as, what they call it, vaccine for cancer. They are still in the trials or in the early stage of, research, which is still not available. For common use, but then we have a lot of new discoveries happening. So hopefully some of those different modalities in immunotherapy will be available to general public soon. But then at least the checkpoint inhibitors are available right now. So just make sure that if you know that you have a cancer or someone loved one have a cancer, make sure to check whether this type of cancer is effective using immunotherapy.
And if you take the immune therapy, I'm sure there is a chemotherapy inside the immune therapy. What do you think?
Some of them, yes. I think in the right now, many of those clinical trial testing right now is a combination with the traditional chemotherapy combined with one of those immunotherapy.
Of course, yes.
Doing this, so which is actually a really great.
I know this. I know this medicine very well. So, okay, so can you please, what else? Immune therapy and what else?
Okay, so if you can go to page 17, this is actually a really big news a couple of years ago. What we call is a KRAS mutation. So, so if you go to page 17, that'd be good, right?
Yes.
17. So this is the new drug which is become available back in about 2021. The name is used to be called AMG 510, but then it's now called sotorasib. So this is a new drug which is effective in certain type of cancer with gene mutation called KRAS mutation.
KRAS, okay.
KRAS is a pretty commonly mutated, especially in the lung cancer and as well as a pancreatic cancer, and it's pretty complicated. Because KRAS has so many different type of mutation, so this is this medication works only on one type of a KRAS, which is a KRAS G12C mutation. So if you have this type of a cancer, especially the lung cancer or colon cancer or with the also a pancreatic cancer, just make sure that you test genetic test on those cancer and then see if you see this, KRAS mutation is happening. If that's the case, then it is a good idea to test this medication called sotorasib.
Okay.
Because primary target on this particular KRAS mutation, so which is approved just recently. So this is also good news for all of cancer scientists as well as oncologists.
Okay, great. So if we apply or we go to the website you gave us like a little bit ago, we can do that trial clinic on ourselves or, correct?
At least, you type in the type of a cancer, they will tell you all the, clinical trial, which is right now available. Okay. And also, of course, where you live is also important, right? Because you don't want to go to like a Florida or, if you're living in California.
Yes, you have to be around, yes.
You can, if there are lots of clinical trial, you can actually narrow down by selecting your own, state. And then that will actually kind of, also
direct you.
Try to actually, select only something that's available in your neighbor.
Okay, perfect. Okay, so, okay.
So next one, the exciting thing is about the brain tumor and the lung cancer. So if you can turn on page number 18, that'd be great.
18, yes, page number 18.
I'm actually telling this because this is already being approved in to use in GBM or brain tumor patient, and it's already FDA approved. But then I noticed that the many even clinicians probably do not know about this. So that's why I would like to actually tell you that this is already approved in some cancer, which is what we call TTF, tumor treating field, or sometimes we call alternating electric field, or AEF. So this is basically it's something that we administer those low intensity and intermediate frequency alternative electric field, which is delivered to the skin by using a cutaneous transducer arrays. So if you can see, and now I think you can see it from here. So for this actually treatment, it's already approved in a GBM, which is the most aggressive form of a brain tumor in adult. This is already approved to use in a recurrent GBM in 2011 and also newly diagnosed GBM in 2016. One good thing about this is that this is not a chemotherapy. This is like basically a pad that you attach to your head. You have to, unfortunately, you have to shave off your skin in order to put this patch. But then basically this will be the not the chemotherapy. So you sometimes you have to take a chemotherapy and receive this treatment, the TTF treatment. But then because this is not a chemotherapy, so you will not have more significant what do you call it, adverse effect from a drug. So this is a really good kind of a treatment where it is scientifically and medically already proven that if you use this in a GBM or brain tumor, it will extend the life for, on average, several months. So for GBM, extending a life for like a few weeks is already significant. So this treatment, if you combine with a traditional therapy, it can extend the life significantly for at least for a couple of months for sure. So this is a really exciting advancement in the cancer research in the oncology field. So unfortunately, this is really difficult to treat. It's not going to be a cure, but then at least this will extend the life without adding too many adverse effect or side effect. So it's already approved in the GBM, but then this is also being tested in a phase 3 clinical trial for lung cancer. So hopefully by the end of this year, if we get a really good clinical trials for lung cancer, then most likely this therapy will also be approved for lung cancer as well. So this is a really good, exciting news.
Okay.
So another one, if you can turn to page number 19, that'd be great.
Page 19.
So this is something that what we call boron neutron capture therapy. It's called BNCT. So this is actually known to be very selective radiation treatment. And actually, this therapy was first discovered or invented here in the United States back in I think that was 1940s or 1950s, a long time ago. But then United States somehow abandoned this therapy because at the time there's no good medication to deliver this stable boron isotope or 10 boron. So that's one issue. And also the fact that in order to get the neutron source, you have to have a clinic or hospital right next to the nuclear plant. With nuclear plants, no one wants to go there, right?
Is
right
this
there.
injection, doctor?
Yeah, it's an injection. Yeah, so injection. So basically, in BNCT treatment, this is actually the new type of treatment which is already approved to treat in Japan, Taiwan, and Finland for brain tumor and head and neck cancer already, but they're not in the United States, unfortunately. But this will be hopefully in next 3 years. The new facility will be built here in Southern California, Berkeley. It's probably you may have heard about this university. It's called Loma Linda University. They are planning to actually build this new facility, and then they try to start this BNCT treatment for brain tumor and head and neck cancer within the next 2 years or so. So this is a really great advancement, or news for cancer research.
Okay. So
Okay.
now we have new 3 treatments. Do we have more?
Well, I think that's all something that is already in horizon or newly approved. But then there are many other type of cancer treatment which are still in clinical trial in the different phases, like a phase 1, phase 2, or even phase 3. But then the one that I introduced to you is something that it was already approved. You can use it.
So this is the only approved. Okay, 3 treatment only approved. Okay, got it.
PMCP, unfortunately, it takes another 3 more years to build here in the United States. But then this treatment is already, available and already approved to use, meaning that they're covered by insurance in Japan, as well as Finland and Taiwan and some other places. So it's such a shame that we United States didn't have it, and they finally start to build. Because this technology was first, again, like I said, that it was actually first developed here in the United States back in.
So do you think, doctor, in the coming few years it will be more treatments and maybe that disease will disappear? Maybe because you said 20 million right now. This is really scary number, really sad number.
It is, unfortunately. And then, well, again, as we age longer, which is good news, right? People are actually, living longer. That's a good thing. But
Yes.
then as we live longer and longer, then, cancer's, rate will, unfortunately also start to, increase. So these are something that we have to tackle. And we hope that, we're going to have more and more new therapies will be available. Not only new, but then new and effective. And also, affordable. So that's something that we really strive to do so.
Okay, doctor, before you go on, we in our community, Arabic community, we have reached a very like a conclusion. I don't think it's a correct conclusion, but people who get sad or mad or they fight with their loved ones a lot, they might develop cancer.
Look,
Is this correct or not?
like a stress, right? Stress. So there's still a debate.
I know
And
it's
some-
inconsequential, but
Still, I think it's still a little bit more, it's a little bit controversial still. I know that some people think that, oh, don't be stressed too much, then it's going to, aggravate your health, meaning that, your health will be, will be bad, right?
yes.
So I think, I don't think, from the literature or research that we have right now, I don't believe that having too much stress and constant stress will
Could cause cancer.
get into the cancer per se, but then it's not good for you mentally, right?
Yes,
For-
mentally, and your immune system too. You're destroying your immune system when you're stressed.
It could be, yes. So it could be just it may not cause directly a cancer, but then if you're under stress and all the time, it's not good for your health overall.
Okay.
That can be contributed a little bit to it can probably increase chance of a cancer, but then having stress, having under constant stress itself, like a mental health, mental stress itself is not a major source of having cancer. So don't worry about it. But then as for
But don't stress. In the meantime, don't stress.
don't stress, try to be calm and when you're living 24, we all have 24 hours, right?
Yes, correct.
Per
We all
day.
have 24 hours.
You better try to stay happy and calm and right, rather than being angry, right? So just try to be happy and calm and
Try
relax.
to enjoy the moment.
Enjoy. Yes, exactly. That's what you want.
Okay.
So the next one, I'd like you to actually go for page 23.
23.
That will tell you, so this is a little bit older study, but then this is actually still, presumably true even now. So this will tell you the top 3 causes of cancer. So number one, people think still that, most cancer, but then, as you know, cancers have so many different types of cancer, right? Different organs, and then even same organ, we have a different subtype of cancer. So you can't tell that this will true to all the cancer, but then if you take a look at the overall, okay, so diet or, your own lifestyle is number 1 cause.
Okay,
which
1 second. Do you think diet, when we diet, so there is wrong ways to diet, which it could cause cancer? Is that what you mean?
yeah, because if you take a really, high, high fat and the enriched food, sugar, processed food, that really can, lead to unhealthy lifestyle, and it
Oh,
can
okay. So, yeah, you mean by diet is unhealthy food.
So diet is, so far one of the top three contributors of cardiovascular cancer death, and obviously tobacco is, of course, about 3% of cancer deaths caused by tobacco,
Okay.
which is something that we can also do something, right, like quitting smoking and so forth, right, and then maybe a lot of people actually do not know, but some kind of infection, like a viral infection to bacterial infection, can also cause a cancer, which attributed to about the 15 to 20% of.
How we protect ourselves from infections? Because infection, we don't know how it happens, right?
Yeah, exactly. So what I want to do is I'm going to talk about how we can lower the risk of cancer, right?
Okay.
So I would like to actually turn to page number 25.
25. Okay.
So so the food and the tobacco and so forth, those are all lifestyle related, right?
Okay.
So these are something easiest, presumably easiest to modulate or fix. But then it's actually easier to say than done, obviously, right? It's so difficult to change your lifestyle, obviously. So, but then the important thing is how we can lower the risk. Something everybody can do is changing your lifestyle. So, do you see page number 25 right now?
Yeah, actually, great ideas. Actually, I love that. Wear sunscreen, eat healthy, and exercise. Wow.
Tobacco smoking, try to eat healthy food, moderate exercise, try to maintain proper weight.
Yes.
If you drink alcohol, just try to drink
Yeah, maybe
alcohol.
occasionally only, or don't.
Skin cancer, of course, UV protection, right? Like wear sunscreen, wear the hat or cap or something. So
Yes.
So those are really something that easily can be done. So
Yes.
yeah, something like changing a lifestyle would be hard, but then that's something that we can control ourselves, right?
Yeah, but it's very about the sun. The sun is important for you for the source of vitamin D. Also, it's bad for you, could cause cancer. How we can balance this thing?
Making a vitamin D from the skin. So if you can expose sunlight for, I think there's my understanding. Okay, I need to also check too. But then,
I know.
If you have a sunlight for about 10-15 minutes,
Okay.
that should be enough for daily.
That's enough. 10 to 15 minutes on the sun. Yes. Other than that, you have to wear the sunscreen.
Sunscreen, yeah. So good for your skin, right? Not only cancer, but then sometimes if you have too much, suntan, later in life you have sunspots you develop,
Correct.
and then some others like wrinkles in the skin. So for the beauty aspect, yeah, of course, better to avoid too much sun.
Yeah. Okay. Very good idea. Okay.
But vitamin D, you don't have to expose yourself to 1 hour, 2 hours per day, right? It's probably like 15 minutes or so. That should be enough.
Okay.
Good vitamin D for the skin. So if you can turn to page number 26, that'd be great.
And exercise is very important, everyone, because we in our community don't exercise much. So exercising is number one to protect yourself from any kind of disease.
It is. And then, ideally go to gym and then do exercise. Okay, but then, no, you don't have to.
Just walk, maybe.
You can just walk and then light jogging, or, just walk for 15 minutes, 30 minutes per day. That should be also, enough. So
it's good for your body and mind.
and mind too, exactly, yes.
Okay, and page number 25 now?
Well, 26.
26, okay. How can we lower the risk? This is very important.
So remember that the infection, right? What I said, about 15 to 20% of cancer, it actually caused by the virus or some kind of bacterial infection. So, but then good thing is that many of those virus or bacterial infection, there's a way to treat or prevent. Like for instance, like I said, at the HPV, right? HPV can cause head and neck cancer as well as a cervical cancer for women, right? For men, mainly like a head and neck cancer, right? So now we have a good vaccine for HPV.
Okay, so you have to be treated. Okay.
If you have a youngsters like the teenage girls or teenage boys, also for boys, if they don't have an allergic reaction to those vaccine, then try to get the vaccine for HPV possible. And also the leading cause of liver cancer, not a metastasis, okay? Leading cause of primary liver cancer is because of a hepatitis virus infection. So nowadays you may know that we have a hepatitis B vaccine available, which is actually given in
And I'm sure it's an effective vaccine.
Yes, it is. Yeah, usually you have 3 doses. It's going to protect you almost for the rest of your life.
Okay.
Yeah. So HPV vaccine and the hepatitis B vaccine, again, if you have a chance or if you haven't done it, try to get it. So this will prevent you to get those viral infection. And then, so hepatitis C is actually the leading cause of, liver cancer before. But then now we have a very good medication that you can actually cure hepatitis C now. So if you know or your loved one is having a hepatitis C infection, which is usually chronic, try to get the medication, and so that it will eradicate the hepatitis C virus from your system. So now we can actually even cure hepatitis C now.
Okay. And actually, it's really easy to go and test and screen for hepatitis C, right?
Let's see. Yeah, hepatitis C. Usually, people will usually, come with some kind of a hepatitis, the inflammation in the liver. People sometimes go to the clinic because of the symptom for hepatitis, and then you find out that you have a hepatitis B infection or hepatitis C infection and so forth. So nowadays, hepatitis C at least we can actually pretty much cure most type of the hepatitis C. So we definitely try to eradicate those viruses from your system.
Okay.
And another one, which is actually I heard that it's not really common in like a Caucasian population, but it's actually more common in Asian population. But
yeah, H. pylori.
Yeah, H. pylori.
Actually,
yes.
it's common in our country, I guess. Most of Arab people, they have the H. pylori, and even they don't know about that. And it's very simple test.
Right, there's some simple tests right now. Yes, exactly. You can just if you have a chronic, like a pain in the stomach, for instance, and then you have an ulcer, well, just try to test. And if you have a Helicobacter pylori, then there's lots of different type of antibacterial you can easily eradicate. So if you have a persistent inflammation inside your stomach, sometimes it can cause gastric or stomach cancer.
Yes.
So that's why it's important to just not to have all these infections.
Yeah. So we encourage every viewer actually to go and check the H. pylori. It's very easy, and your primary care doctor can help you on that.
Exactly. And especially if your community has a high incidence of H. pylori, then get a test and then see if you have it. If you have it, then just take the medication, eradicate those viruses so that it can prevent
so I never knew that could cause cancer. So thank you so much for this piece of information. Okay.
So another one that page, if you can turn to page number 27.
27. Okay, 27.
Yeah, early diagnosis is another key. So if you have, let's say, certain age, and then you're eligible to get the screening, like prostate cancer to breast cancer, then try to get it. And then, like for instance, like a colon cancer, for instance, if you have a family history, then you have a little bit higher incidence or higher chance to get the colon cancer. So for those who are in a higher risk, make sure that you get the screening.
Okay.
Also, another thing that people just probably do not realize is that sometimes even if you try not to have a diet, but then you lose weight, like 10 pounds in 1 month. You don't do any diet, but then for some reason you
You're
lose
losing
weight.
weight, yes.
Unexplainable loss of weight is, of
It's
course,
question mark, yes.
yeah. So better to get tested.
To
Of course,
address it, of course.
other causes, of course, sometimes, thyroid, condition may lower the, weight, but then sometimes it can cause by, cancer. So if you experience that, oh, I'm not doing any diet, but then, hey, I lost like a 10, 15 pounds per month, it's like, oh, no, that's not a good sign. So just make sure to just check out for any possibility. And then again, people always talk that, your own body, you know your own body the best, right? So just monitor and then, your body, then something is off or not really feeling right, then, the best is to just try to see, what happened with your body. Because again, you know your own body the best.
Yeah, we ignore sometimes. We have symptoms, but we ignore it, and then it's too late. So we have to address the problems early.
Yeah, so know your best. And also, so at the beginning, I was a little bit talking about this pancreatic cancer, right? So for instance, I know that in the United States, there's no good screening or good, preventive measure for pancreatic cancer, ovarian cancer, and then some of those cancer, because it's, first of all, it's a rare cancer, and then, but then once you get this cancer, then it's so difficult to treat. Vast majority of people usually die within, few years to up to about 5 years.
So what we should do, doctor? Travel to Japan or what?
No. Just know your risk. I mean, yeah, if there's only one treatment that really works, then it's worth to travel. But then other than that, just study your family history really well.
Yes, family history is very important, yes.
Yeah, so pancreatic cancer, for instance, right? So if you have a family history, or if you have pancreatitis, or sudden onset or worsening of diabetes, or obesity, these are all,
So diabetes, doctor, could cause cancer?
No, not cause cancer. But then what happens is that sometimes, even if you don't have a family history of, diabetes, because diabetes is pretty much
common, yeah.
Also genetic, right?
Yes.
Diabetes, then you may have it. But then if you don't have your parents do not have a diabetes, but then you got the diabetes, sometimes it may cause bowel cancer.
Okay, got it. So if you are not inheriting diabetes from your parents, so maybe this is a sign for cancer.
So what happens is that, once the cancer develops inside of pancreas, right? The pancreas function is to, secrete the insulin, right? But, once the cancer starts to grow and grow and grow, sometimes what happens is that your, pancreas cannot, function normally, right? So, and then if the pancreas cannot, produce enough insulin because of the cancer, then you may probably experience like a diabetes or a diabetic, symptom.
Okay.
And
understood.
So good to know all these risk factors. And then the example that I would like to show you is page 28. So if you can go to page number 28.
Okay, page 28.
It's a clinical research.
Early diagnosis, okay.
Early diagnosis. So if you take a look at the, the line, the very, very thick line is stage 4 pancreatic cancer. So if you have a stage 4 pancreatic cancer, then let's say within 2 years, almost 90% of people die, right? But if you take a look at the stage 0, stage 1, which is a faint line on the top, if you see the statistic, if you discover pancreatic cancer in an early stage, even after 10 years, more than half of people are still alive.
Okay.
Yeah, exactly. Yeah, that's the one. But then unfortunately, people who come to hospital or clinic with a diagnosis with the pancreatic cancer, they're usually more than 2 centimeters or more, like larger size. So in that case, then people usually die within 5 years. But your size, small enough, less than 2 centimeter, then your 5-year survival or 10-year survival or curable rate is very high. So that's why it's really important that some type of cancer, if you diagnose early enough, then pretty much survival rate is very good.
Yeah. So yeah, we'll talk in the end about the screening because it's very important, and we have lack of knowledge about the cancer screening. But let's finish the presentation, and then we'll talk about the screening.
Okay. Yes. Got it. Okay. So if you can go to let's say page number 30.
Theory. Okay. Page number 30.
About the medical society that I'm involved. But
the mobbing, yes.
Yeah, so the brain
mobbing, yes.
People brain mapping and therapeutics. So on the page number 30, so this is actually the organization that I'm actually fortunate to be one of co-founder of this organization.
I know you are the CEO,
but
you're humble. I know everything.
No. I'm actually currently serving as an executive director for this medical society.
Okay.
So our mission is that by having this organization, we will just try to fast track, develop a better way to treat and diagnose and prevent neurological disorders. That's including everything from Parkinson's disease, dementia, to some spinal cord problem, to so forth. Anything brain and spine is something that we are targeting right now. And then me as a cancer scientist, I'm actually interested in how develop a better way to treat or diagnose a brain cancer. So that's my goal. And then this society have been active in not only in scientific conference, which we have it annually, but then we also formulate a lot of initiative in the United States as well as globally through such initiatives such as Brain Technology Innovation Park, to annual congressional briefing on brain research.
Yes.
But we conducting a brain mapping day at the Congress, and as well as a global version of our initiative called Neuroscience 20 or N20 during a G summit. So we basically just rotating around the countries where the G summit is happening. This year it's going to be happening in Brazil. So we expect to actually go in Brazil to have this.
Nice. I'm gonna miss the Brazil one, but I was really fortunate to attend, last week a seminar with you, and it was really beautiful. So thank you for inviting me. A lot of great and valuable information about, the study.
So if you can go to page number 33 for the time.
33. Page 33. Let's see what's in page 33.
So page 33, I just show about our main, event, which is annual, scientific meeting, and as well as a fundraising gala.
Yes.
So if you can pay attention to the picture in the center.
In the center, yes, it's me and you.
And then,
was a beautiful night, Doctor.
It was, yeah. So it was, it was a pleasure actually speaking with you, and I'm not so sure how much time we have, but then, I'd be happy to take any questions. Or,
Thank you. Actually, it's amazing and great presentation. Very, very specific, organized, and has lots of valuable information. Can I share it with our viewers later and in the social media?
Yeah, sure, of course.
Okay, I just value your time and the information you gave us. Such a very important subject. Can you summarize and tell us some advices for the viewers, please, how we can take care of ourselves? Also, very important to do the screening, where we go for the screening, please, and the website again one more time.
So, of course, the message to you is that the cancer is really complicated and then also global issue. Anyone and everyone may get a cancer in some time of life. So we hope that by providing this talk, I hope that you know the current status of cancer right now, globally, as well as in the United States. And I hope that you have to know that each type of cancer have very different outcomes and different, progress rate. So we have to study really well, and we have to also research your own doctor, and then get many effective treatment options as possible if you or your loved one get a cancer. Just try to study and then select the best treatment for for you or your loved one. That's important. And also it's better to prevent the cancer early on. So we just try to make sure that if there's something that we can prevent, like for instance, changing your lifestyle to like stop smoking or do some light exercise, eat healthy food, and also try to get rid of some bacterial infection or prevent a viral infection. If that's available, try to take a opportunity to take advantage of all these options available so that we can prevent the cancer. And then lastly, so if your community has a screening and you know that you have a high risk of a certain type of cancer, try to do a regular screening. So
Doctor, if though we don't have the high risk, because it attacks anyone, anytime, and it's like unexpected. So I think all of us, we need some of screening.
Correct, yeah. Screenings are normally, as you may know, it's only available for like a common cancer, like a lung cancer, right? Or breast cancer and then prostate cancer. So those are type of screening which is usually available anywhere in the United States, right?
Okay.
So you have insurance. So these are kind of a common cancer. Try to even if you don't have a known risk, it's probably good to take it because it's
just good just to check yourself. Yes.
The rare type of cancer, like the pancreatic cancer, for instance, that just try to check, and if you know that you have a very, very high risk for ovarian cancer or pancreatic cancer, then try to be vigilant, and then make sure that you, if possible, try to get some kind of early screening. It does not need to be every year or so, but then maybe like once in 3 years or something.
Okay.
You don't have any abnormal nodule in your ovaries or your pancreas, right? So if possible, try to just kind of monitor. But then those are really rare cancer, of course. But then again, if you have a high risk group, or you have a family history or certain type of genetic mutation, then I would definitely try to monitor myself for you.
Okay, doctor, thank you so much. Doctor, can you please tell us about the clinical trial website one more time and what we should go and do in that website?
Okay. So maybe what I can do, so the easiest one will be www.clinicaltrials.gov.
Okay, clinicaltrials.gov. Very easy, clinicaltrials.gov, okay?
And there's another website, if you go to, so this one has a very long name. So what I can do is actually I can type in and probably gonna give it to you, or maybe I'll email to you, Mira, so that you can probably share that in your audience. Would that be okay? Or
just send it to me, and we're going to add it to the episode later. No problem.
So that second website is specifically for cancer treatment. But then the first one that I showed to you, which is www.clinicaltrial.gov. This is a website where you can actually see other, condition besides cancer too.
Okay.
Like a stroke study, to like a heart disease study.
Any disease study. Okay.
There's a keyword that you can enter, and then
the zip code as well. And the zip code, so you can find the centers near you.
I think they have a section for selecting states, different states, like a California. New York or something. Yeah.
Perfect. Okay, thank you so much, Doctor. Such valuable information, and I would love to come to your comprehensive center maybe, and we can do another episode over there. And I'm looking forward to attend your seminars and teach the community about the really deadly cancer disease, and hopefully with your researches and other doctor researches, we can end this cancer.
Yes, definitely. That's our goal.
Hopefully, we're hoping because it takes lots of our beloved people. Thank you so much, Dr. Vicky Yamamoto. You are very kind, and I really enjoyed seeing you in the seminar and today, and I'm looking forward to work with you more.
Sounds great. Just looking forward to it.
God bless you, Dr. Vicky. So everyone, I was very pleased to have Dr. Vicky Yamamoto and such a valuable information. As I said before, please take care of yourself, eat well, stop smoking, drinking, exercise more, and live happily. Love each other, forgive each other, and always pray. I love you so much. واشوفكم في حلقات جاية من اسأل مع ميرا. باي باي.
Thank you.